People generally ask me, how do I know when I'm having a bad day? It's the same with not regular people. If you are imagining that you're holding, an ice cream in your hand and you know for a fact that that ice cream is going to fall, even if it is in your imagination, that is considered a bad day. Hello everyone, welcome to Naren's Life with MS. This is Naren and it's time for Friday Findings. And I'm so excited today to be discussing these two articles with you because both of these articles, first of all, I'm very excited to note that they're from the same source, as in the same, the same place pretty much published these articles, which means that they will more or less read in similar fashions. But apart from that, both of these articles are actually in certain ways really good, and in some ways are also pretty meaningful for the right reasons, right? There is definitely the whole idea of understanding the disease at a much deeper level and really breaking down some of the misconceptions or pretty much some of the earlier thoughts that used to exist in regards to multiple sclerosis. So of course, with that being said, there is quite a bit to discuss, and I'm so glad that I am going to be doing all of that with you. So why don't we get started? Here is article number 1. Article number 1 discusses the McDonald criteria. Now, this is not regarding, how many pickles generally go on a Big Mac. No, that is not the case. The McDonald criteria was actually created about 2 decades or a little more than 2 decades ago to pretty much define sort of the framework that goes on to diagnosing a person with MS. So usually, there are certain tests that are conducted. There is also a certain, evaluation of, a certain person or potential patient to pretty much gauge, not only whether their tests show a sign that they might have MS, but also apart from that, um, also showcase, also evaluate how the patient is pretty much you know walking, talking, thinking, pretty much doing all the functional activities to pretty much be able to diagnose, um, you know, them with MS. So that is pretty much the McDonald criteria, and that has, of course, constantly, ever since it has been created, it has constantly been updated. And the most recent update, which occurred in 2024, actually has made some major changes to the McDonald criteria to ensure that that MS patients are, there are easier ways to diagnose people with MS. Earlier, the criteria was pretty stringent on what doctors could see, not only from the test but also from seeing the patient sort of function. And a lot of that has pretty much, quite a few things from that have literally been removed from the criteria, allowing patients who are technically asymptomatic, not showing any of the regular symptoms of MS, to still be diagnosed with MS based on the test results that they might show, some of the and just pretty much through a lot of the clinical tests that have gone on with this potential patient. What that allows is, it allows for patients to be diagnosed a little earlier, and of course allow them to get a much better understanding of, and also doctors to get a much better understanding of how, patients who definitely are diagnosed at a much earlier stage, how they are, how they go about, their disease, managing their disease. So that is a great thing to have. Apart from that, another thing that the McDonald criteria does is it now pretty much creates a spectrum where we have both the relapsing forms of MS and the progressive forms of MS to pretty much function on the same spectrum, right? Earlier, MS was pretty much seen as, oh yes, you have a relapsing form or you have a progressive form, right? There were, there were indications that, both of those could happen to a certain patient, but, they were pretty much kept almost on an exclusive basis. So if you have the progressive kind, you obviously cannot get relapses, or it's very rare for a person with with relapsing form of MS to actually see progression in their disease. Now, considering that they have turned it into a spectrum, it is a lot easier to map patients along that spectrum, because they might be experiencing both sides of the both sides of the coin, right? I mean, I can definitely recall that the last time I had a relapse was most likely in 2018, which was a pretty bad relapse. And then, but at the same time, I do know that there was progression in my disease for the few years since before that relapse. So, it is definitely allowing a lot clearer of an indication of, how MS is actually working from person to person. Of course, one of the things that does happen as a result is that, the biomarkers that are generally used when therapies, when new drugs are being tested, those things will need to change. And I'll give you the reason why. Earlier, what used to happen was that, considering that MS was pretty much divided in half between relapsing and progressive forms of MS, generally when drug trials or any new trials were being conducted, they were conducted just on the basis of whether whether this medication or this therapy was more focused towards the progressive forms or more towards the relapsing forms. Now, considering that they are on the same spectrum, now all of these testing, all of the test parameters that were being pretty much identified have to change in that way, so that it change in such a way that pretty much um, they are inclusive of both progressive and relapsing tendencies in all patients, because as we know, every patient can be very, very unique in their own way, right? There definitely is not one blanket issue that all MS patients have, besides the main one that we're all losing our myelin. Besides that, all of us can display the disease in different ways, and for a lot for a probably a very big number of people, they might even be asymptomatic. And as a result, this new change definitely does show a lot of benefit. It does make things a little bit more complicated for people testing out new therapies, new drugs, new treatments. But considering that these things are definitely needed to ensure that we get a better understanding of what this disease does, there are, of course, some great things that I foresee in the future with the new McDonald criteria that has come out. So of course this is great news, not only for the current patients of MS, because now there is going to be a little um, there is going to be in some ways more detailed testing of new drugs, new therapies, new treatments. But apart from that, even for future patients, because they will have the chance to be diagnosed with multiple sclerosis a lot faster and get the much needed help they uh, probably would not have had until years later, when their symptoms would have finally finally surfaced. So that of course covers article number 1. So yes, please do give your thoughts, your insights, your experiences as to how this can be very helpful, and of course we will get the conversation started. But now it is time for article number 2. Article number 2. Now, this article goes again into a study which is focused on oligodendrocytes, right? Now, you might be thinking, oligodendrocytes, didn't I talk about that 2 weeks ago? Yes, I did, because oligodendrocytes are the um, I guess you can call them cells. They're part that they are part of the they are cells in the body that actually do create myelin. And one of the things that scientists have found is that there is a certain protein called the piezo2, piezo2, which pretty much has been seen to be one of the reasons that myelin is created by oligodendrocytes. And one thing that has happened, and they have done this study with mice, where mice with fewer piezo 2 expressions in their bodies actually saw fewer less myelin being produced, and as a result axons being exposed, and of course degeneration of pretty much the myelin sheath that is covering the the spinal cord of mice, right? That covers pretty much the mice side of the study that was conducted, and pretty much shows that the with the absence or the reduction of piezo2 um, piezo2 protein in the body, the oligodendrocytes will not create myelin to the same extent that they would in healthy adult mice. So that was the first part of the study. So obviously scientists said, okay, can we see the same expression, same thing happen in humans? And they did do a study concerning humans, well, at least diseased humans, who were both healthy and of course with MS. And in that case as well, the one thing that the scientists covered were the optic nerves of all of these people. And the one thing they saw was that with the reduction of piezo2 in the optic nerve, there was about a 50% reduction in oligodendrocytes that were creating myelin. And even the reduction in the piezo2 gene, which creates the piezo2 protein, um, led to led to less myelin being present in the optic nerve. And considering that, you can almost imagine you know you can almost imagine myelin as being sort of the covering, right? The rubber tubing on all wires. Every single nerve requires myelin. It's almost like it is necessary for myelin to exist so that the nerve can function properly. And of course, noticing that piezo2 might be that one connection that relates to the having a direct impact to oligodendrocytes manufacturing myelin. This might be one way to actually see if there is a potential treatment or therapy for MS in regards to that. Of course, in addition to all of that, considering that this is again a study that was predominantly done on mice, and then there was some research done with you know some human research subjects. Of course, there is a lot more testing that needs to be done, but this is happening alongside a lot of the different tests that are being conducted, have been conducted, where considering that there are a lot of these things usually start off with a mice model. Usually we it definitely takes a few years to get human subjects involved so that the testing can progress. And considering that scientific testing is really dependent on how much how much funding the scientists receive, and how and how the how they are pretty much designing these experiments, designing these studies. Usually it does take a very long time to get all of these different identifications, all of these different things and pieces to come together to finally get a proper study out that does evaluate what what a protein like piezo2 might actually impact on the myelin creation done by oligodendrocytes in the human body. So of course that covers article number 2. I hope you did get a little bit of understanding of this. Of course, the link to this article is available in the description section of the video. And like I said, I'm so excited that that um, there is always new research with MS. There are new proteins, there are new biomarkers, all of these things that are being found that might actually make understanding MS a little bit better, and just getting us a little closer to finding something that can really work with every single patient, right? So that covers article number 2. So what did you think of these two articles that I discussed today? Right, I first of all, the thing that I'm most excited about is the fact that both of these articles are from the same source, which means that there is no registration that you will have to do. You can read both of these articles in full, and definitely come up with your own evaluations of how these articles, what kind of information was presented in these articles, what you really want to gather, and definitely form your own opinion of where either of these articles can definitely take us, right? Of course, apart from with all of that being said, I do hope that you are very excited for your weekend, and do definitely do read these articles, do share your thoughts, your insights, your experiences, so that we can get a conversation started. But considering it is the weekend, I do not want to keep you much longer, so I just want to say, this is Naren Sai with MS. I am Naren, and here's me wishing you a good night, sweet dreams, and before I say I will catch you tomorrow, happy weekend, and I will catch you tomorrow. Bye.